everyone. Thanks so much for joining me for this week's episode of When I Grow Up. On today's episode, it is my pleasure to welcome my guest today, Jason Rowe. Hey, Jason, how are you?
I'm doing great. How are you doing?
I'm awesome. Actually, I'm so sorry. It's Dr. Jason Rowe.
Oh, that's okay. That's okay.
Well, Dr. Jason, I'm extremely excited that you're here today for many reasons. Okay, for many reasons.
Yeah.
First, just a little bit of embarrassment for you, I guess. No, it's not embarrassing. It's not embarrassing. I just want everyone to know that I've known Jason since he was like in elementary school.
Yep, that's right. Been a long time.
And
yeah.
It is crazy. It's crazy like that I'm sitting with you here today to hear about your life and what you do now. So without further ado, Jason, what do you do?
Yeah, so I'm an optometrist, which is a primary eye care provider. My main role it kind of varies quite a bit, actually, and even among optometry itself, there's a vast role that you can play. But I mainly do primary eye care, part days throughout the week, and then the other times through the week, I co-manage patients with ophthalmologists through an OD/MD co-management practice. And that's pretty much what I do on a day-to-day basis. So ranging from glasses and contacts all the way to treating glaucoma, watching for diabetes or cataracts or things like that. So all general health things, eye things primarily, of course, but mainly other things that manifest itself in the eyes.
Okay, and the second thing I'm excited about, because I didn't mention, is this. Like, you're an optometrist, which is so, like, cool because I've been going to an optometrist my entire life, mainly.
Right. Yeah.
I realized, like, in my community of people that are, like, just in my close network, there aren't any optometrists, which is I feel like, oh, that's kind of weird to think about. So I'm curious. I want to hear all of the technical details of your job too. But before I jump into that, Jason, why did you decide to be an optometrist?
Yeah, so it was a pretty long journey and process. Like you said, I didn't really know much about optometry growing up either, especially because I never really wore glasses, so I didn't really think that it was necessary for me. At least my parents thought that. But on the flip side, my brother had to wear glasses. He's a little bit older, and he's part of the reason why I chose optometry. In a different sense, I'll kind of explain that in a little bit. But basically, I was a junior and senior in high school, and growing up in a typical Asian American household, my parents, wanted me to pursue being a medical doctor, but I knew I didn't want to do that because I personally didn't want to bear the responsibilities of some sort of life and death situation. That's just me. And I knew no matter what direction, if I'm a doctor, whether it's family care or, endocrinology or neurology or whatever type of, MD that I would be or DO that I would be, had I chosen that path, if something life-threatening were to happen, people would turn to me and be like, what do I do? And I did not want to deal with that pressure. As well as the schooling as well. I just didn't want to go through that many years. My cousin, who is 39 now, he's a radiologist, and he just got done a few years ago. And looking through that, I was like, I do not want to do that. Yeah, and so I looked at different professions. I looked online, what I could do. And I kind of just narrowed them out. Basically, of course, there's like pharmacy, dentistry, physical therapy. And I kind of worked through the lists of that. And physical therapy was out immediately because of my brother, who is a physical therapist. And so I just didn't want that sort of competition thing to happen between my brother and me. And, and I get pretty hyper competitive, and so does my brother. And so I feel like we would just butt heads and
I can
clash.
attest to this. Yes.
Yeah. Yes. And so because of that, I personally I had not even considered physical therapy one bit. And so yeah. And then I looked at dentistry, and dentistry among the healthcare professions, they were, I think, the highest suicidal rate. And that seemed a little depressing. And no one's really happy to go to the dentist because it's pretty painful and things like that. And this is no knock to dentists. Obviously, they're really important and things like that. But just for me personally and my perception of it, which I'm sure had I chosen it, it would have changed, just like my perception of optometry changed as I progressed through optometry school. But that was my initial impression. Of course, there was no one that I knew that was a dentist to really ask those types of things. So in my mind, I just kind of tossed that out. And then pharmacy as well. I didn't want to, just handle medications because I like interacting with patients and things like that. And so then I came across optometry, which was also a doctorate program as well. And I didn't really know much about it, again, because I had never, really been to an optometrist except maybe like one time when I was much younger, and they said I didn't need glasses, and I never went again. But then I looked into it, and the career opportunities are very vast with optometry. You can have your own private practice, for example, where it's just you deal with patients, and you see them, you see their families, see their kids and things like that. And basically you see them for generations and things like, and for really established practices, if you go that private practice route. Or there's the VA route. You can work at a hospital. You could work at another private ophthalmology, which is the route through medical school. There's that route you can go regarding eye care, which primarily go through surgical procedures and things like that. But again, I didn't want to go through that process, and so I looked at that, and then I was like, oh, I might be interested in this. And so I decided to shadow an optometrist locally in Marietta. I just shot him an email. I was like, hey, I'm considering optometry. I don't know anything about it, but I would like to kind of find out more about optometry. Is it okay if I shadow you? And this is my senior year of high school. So it was relatively early when I shadowed.
Wow.
Yeah, I'll admit, I think I was the most ambitious my senior year of high school, I think.
That's kind of insane, I feel like. I mean, no one when I was in school was like pursuing anything that hard that early.
Yeah, I agree. I credit my parents a lot, especially my dad. I mean, he is the most driven person. If anyone knows my brother, he's far and away the most driven person I know. And, it shows by all the things and all the major steps that he's taken in his life. And so that's just where I got that drive. And that's how it started with optometry for me when I was a senior in high school. And so, yeah, I shadowed him and asked a bunch of questions, saw what a day in the life was. And his practice was great. He had his old, I think it was like 8 years old at the time, golden retriever dog, just kind of roaming around the office. It was super laid back. And, he was catching up with, kids. And when I shadowed, he had seen kids that he had seen since, literally they were born and 2 years old when about their first eye exam was, all the way through high school and now entering college. And so seeing that personal relationship was something that I had strived for and something that I wanted to do. And so knowing that optometry school kind of goes through less schooling relative to the traditional MD or DO route, is something that definitely piqued my interest. And so I looked into it a little bit more personally. And then I told my dad, I said, I think I want to do optometry. And of course, at first he didn't really know either, just like not many people do. And then he did the research for himself as well. And later, a couple months later, of course, initially there was a few pushback. He wanted me to, be a medical doctor or at least go like physical therapy or pharmacy or dentistry or something that was a little bit more familiar to his eyes. And so since he didn't know much about optometry, it took him a couple of months to really get on board with it. But then once he said he did the research, he looked at it and he was all for me doing optometry from then on. And so I never looked back, which I think was pretty rare. Like when I compare and look back with my other peers, from the first day of freshman year of college, it's what I wanted to do. And I essentially never really looked back. I didn't consider changing majors or anything. I just knew that, what I had felt was my calling. And so I kind of just pushed through it and persevered through a lot of hardships and made my way. And here I am 8 years later.
Okay, so that was my next question. So
Yeah.
to be an optometrist, you have to go through schooling, but if it takes 8 years, does that mean you have to do 4 years of undergrad and then go to optometry school?
Yeah. So optometry school is its own program. So like I alluded to earlier, ophthalmology is a subset of a medical doctor or a doctor of osteopathic medicine, DO. So you go through for optometry school, you traditionally go through 4 years of your bachelor's degree, and then you apply to an optometry school, which is a 4 year program. And then there's the route of doing, like a residency, for example, which I did for ocular disease. But it's a little different from medical school in that a residency isn't necessarily required. Of course, it's encouraged because it's, continuing education, specializing in things like that. Um, but it's not in the same rigor and intensity as a medical school, residency. Uh, but I ended up going that route. My program specifically was 1 year, but there are programs that can go up to 2 years. So of course it's a little bit shorter than the traditional route either. So I guess if you really wanted to count it, it would be 9 years after. But that's the traditional route. Yeah.
Okay. Okay. So I think I'm getting a little ahead of myself and talking about school and stuff, but
Mhm.
I really should be asking you, what I know of an optometrist. Okay, and I'm at the risk of sounding so dumb right
Oh,
now.
no worries.
Um, okay, so you're saying an optometrist is like somebody I go see to get my eyes checked,
Hmm.
but then you used another word, ophthalmologist.
Hmm.
Is that different or is that just a noun version of
Oh, no, no worries, no worries. So in the world of eye care professions,
Uh-huh.
there's three, I guess, with the OPT prefix, there's three. There's an optician,
Okay.
optometrist, and
Okay.
ophthalmologist. So those
Okay.
are all, yes,
Keep going.
it's all right. Those are three completely different paths and trajectories of that career. So optician, I mean, I could be wrong, but I don't think you need a bachelor's degree. I think you can just go straight into it.
Okay.
And the role of an optician is to basically make sure the glasses fit properly. Because there are so many things and so many minute details that go into a mirror glasses. People that, get them, they think that it's just you get the prescription printed off a piece of paper, you give it to the optician to look at glasses, and that's it. But then there are so many things that play a role into it. And I apologize if I get too like technical, but there's things like optical centers where light has to go perfectly through the center of the glasses, or else if it's off, then they perceive it to be a wrong prescription, but it's not really, it's just not centered correctly in their eyes. And that's why they dot the pupils for glasses and things
Yes.
like that, because they're trying to find what they call the optical center of the glasses. And so it's a lot more work than people imagine it to be, regarding an optician's route. And of course, they fit glasses, make sure it's all fitting properly, comfortable, and they see well and things like that. And then they
Mm.
typically know more of the technical details of the glasses, where they know the different lens materials. They know what kind of company is good for their specific needs in terms of the type of lens materials and things like that. So that's the role of an optician. And then there's optometrist, which is myself. And they go through, like I said, through optometry school, and they are primary eye care providers. And so the the scope of optometry has grown tremendously over the past 30, 40 years, and specifically in the last 10 to 15 years. So initially, what what the average person thought of optometry was true. They mainly dealt with glasses and contacts, and that's it. But especially, like I said, over the last 10, 15 years, I would say even 20 years, their scope has expanded quite a bit, to the point where now they're primarily, primary eye care providers, where they look at the general health of the eyes. And I don't know if you've heard the same, but they say like the eye is the window to the soul. That is like the most true thing when it comes to a biological and physiological standpoint of how the eye works in terms of its anatomy,
Okay.
because the eyes are actually the only place you can look at blood vessels directly without having to cut yourself open. So you can look through the back of the eyes in what's called the retina, and you can see active blood vessels. And the blood vessels are what they call microvasculatures. which
Okay.
is basically a small blood vessel. And
Hmm.
that small blood vessel basically tells an entire story of what's going on systemically with the big blood vessels. And so, usually for things like, especially I mentioned diabetes, not many people think diabetes and eyes, but they're actually pretty heavily related. But if I see signs of diabetes in the back of the eyes, that usually means that if they don't get their diabetes in control, there are going to be more systemic complications such as, peripheral issues or numbness, tingling in their feet, and things like that. And of course, this the general systemic issues that people get with diabetes. And so we're I view optometry as basically a gatekeeper of, not only if they need to go a surgical route, which is I'll talk about later with ophthalmology, but general health as well, because there are just so many things that you see in the eyes that are going to be diagnosed only through eyes. But patients aren't going to know that. They're just going to their main concern is just, oh, my vision is blurry, for example.
Right.
Well, they don't know that their blood sugar or their blood glucose is out of control, and that caused a huge prescription change. And it wasn't that their eyes just blurry, it's that their blood sugar is out of control and it manifests in the eyes.
Interesting.
Hmm. And so these are the things that optometrists are fully capable of managing. And it's really what I manage as well, because like I said, my residency was in ocular disease. So I see tons and tons of diseases throughout my residency, which I still work there now part-time, but yeah, so I see a lot of, diabetes. I've diagnosed multiple sclerosis, for example, by blurry vision in the eyes, and so
What?
that's how it manifests, and things like that you wouldn't realize, that I didn't realize before going into optometry school. Um,
Like, so you're telling me that, like, just by the what you see, like, vascularly, like the veins,
mhm.
you can determine that something is going on.
Yes, that is absolutely correct. So,
That's insane.
especially like I said, because it's the microvasculature that is affected first before the bigger stuff happens
Sure,
first. And
sure.
so, and going back to the multiple sclerosis real quick, the retina is actually directly part of your brain. If you look at it from a neurological and embryological standpoint, it is a direct connection from the brain to the eye. It's an extension.
Right.
So when you think of, when you learn in your basic anatomy classes, your central nervous system and peripheral nervous system, your CNS, PNS, the retina is your CNS. It is actually part of your brain. And so if you think of all the neurological things, such as MS, then you can see it manifested in what we call the optic nerve in the back of the eyes. And so they're not going to know that, And so, for example, you can, for multiple, let's just stick with multiple sclerosis since we're talking about it. But one of the signs and symptoms of multiple sclerosis is this phenomenon called Uthoff's phenomenon, where basically if you're under hot conditions, your vision gets blurry. And that is a neurological thing that happens. And so if I see something that's going on in the back of their eyes that's explaining their blurry vision, sometimes I might ask, when you take a hot shower, does your vision get blurry? And the patient's like, oh, actually, now that you mention it, it does. And so there are things like that where I look at, the epidemiology of their, of the patient, the age, does it match, when you typically get diagnosed with multiple sclerosis and things like that. And so you kind of have to fit that piece of the puzzle to kind of see what exactly is going on. And this isn't like an everyday type thing,
Sure.
of course, but I mean, there are those instances where, you can potentially, through early intervention, make a huge difference, because there are these things that they don't understand, or it's such an early sign that they see through the eyes first. I'm able to stop the progression of it, getting worse more systemically, in that sense.
I mean, no, that is insane to me. Like, I had no idea. Like,
Yeah.
I mean, it's not cool that people have disease, but it's cool.
Right.
I mean, like, do you know what I mean? I mean, I'm sure you know
Yeah.
what I
Yeah.
mean.
Yeah. Yeah.
But like, I had no idea that that was something. I guess I've never thought about it, really.
Right. Yeah. And I mean, to be fair, there's no really real reason for you to think about it, or you blanket statement for anyone who feel like, oh, I just need glasses, problem solved, I got the glasses, life is good. I don't
Right.
need to see them again until I run out of contacts or want a new pair of glasses.
Right.
But
Okay,
there's
so
just,
wait, so real
yeah.
quick though. Okay,
Mhm.
so like um is this like ability to see what's going on vascularly like something that is deeper than looking at their eye on like I mean like you're not like cutting people open to do this, right?
No, so you use a lens, and this is why people are recommended to get annual dilated eye exams.
Right, okay.
Right.
Uh-huh.
And so, you have the colored part of the eye called the iris.
Uh-huh.
In most Asian Americans, it's brown, but of course, with Caucasian or lighter skins, you can get the variations blue, green, hazel, whatnot. And so, when you dilate your eyes, what's happening? The iris itself is actually a muscle, and so you're expanding the iris muscle, and that pupil, which is right in the center, that's actually just a hole. And it's a hole that goes directly to the back into the retina, which are cells that basically capture light signal.
Uh-huh.
And all the light signal of your entire retina converges into one cable fiber called the optic nerve.
Okay.
And then that optic nerve goes to the brain, and that's ultimately what allows us to see.
I see.
Mm-hmm.
Wow. I'm like blown away right now.
Yeah.
That's pretty cool.
Yeah.
Okay. Did you want to elaborate more on optometry, or can you tell me more about the third kind of sector of this as an ophthalmologist?
Yeah. So before I go into ophthalmology, I'll just like very briefly go over the different modalities of optometry.
Sure, yeah.
Again, I mainly do primary care and ocular disease, but
Okay.
there are tons of different, specific modalities of practice within optometry. There's sports vision. That's a huge thing. That's an up and
What?
coming thing.
What is that?
Yeah. And so there's training and kind of like physical training. There's also eye training, where, you go through what you call like saccadic movements or pursuits of the eye to kind of track and better track baseball. So baseball is actually a really good example because when you look from the point at which the ball is thrown from the pitcher all the way to
Okay.
you, that process of following the ball with your eyes and determining in that split second, do I swing? Do I not swing? Is it going to be a strike? Is it going to be a ball? And that whole process is something that you have to process in, a split second. And I don't even pretend to begin to understand that I know the ins and outs of baseball, but in a nutshell, that requires such a detailed eye movement
Okay.
that there are specific, things that you can do to help better track the ball, for example. And so kind of work with exercises in order to better follow that ball and be able to have that hand-eye coordination into being able to swing and
Shut
hitting that
up.
ball.
You're serious
Yeah.
right now?
Yeah.
So there are doctors that help people do that?
Absolutely. Yeah. In the world of sports vision, it's super vast. That's just one of the examples of it. And
That is
so,
that is so cool.
yeah, it is
That
really
is
cool.
that's like
Yeah.
saying you can train someone to have a superpower in sports.
Pretty
That's
much. Yeah. I mean, to be able to, follow the ball. I mean, it is some intensive stuff to do with baseball, especially,
that is insane.
hmm
I'm like floored right now.
Yeah.
I mean, I'm a big sports lover too. I'm a sports
hmm
fan, so like I can appreciate that. And I mean, I guess why not? That's
Yeah.
crazy. Like, so what I mean, I don't know if you know, but do they do like exercises like
They
daily
can't,
or something?
yeah, so they can do exercises. They can do exercises where so when you're following the ball, the specific term is called a pursuit. So you're following the movement of the ball.
Okay.
And so there are certain exercises you can do to enhance your pursuit movement and tracking. And so that kind of, this is a much
Interesting.
more oversimplification of what it actually is. But
Sure.
basically, in your brain, you're able to slow it down a little bit to
Okay.
kind of track it better so that you
Okay.
know.
Yes.
And
So
so,
there are
yeah,
people that are kind of even born with this, right?
yeah.
That's crazy.
Yeah. Yeah. So that's like one of a completely different route
Okay.
of optometry. That's something that you can specialize in. It's definitely an up and coming one. It's not as well known as or as prevalent as like an ocular disease specialized optometrist. And then of course there's neuro optometry, because like I said, the retina is a direct extension of the brain, and so having a big understanding of how the brain works plays a big role into the eyes, especially with post-concussive patients that people see. There's a lot of things that they get with migraines and headaches that are really correlated with the eyes as well. And so that's a route. And then of course there's pediatrics and binocular vision.
Mm.
There's actual vision therapy, which is more of a more so for kids, but also adults as well. If they have what they call binocular vision issues, if their eyes aren't working as a unit, as a singular unit,
Hmm.
there are things like vision therapy that you can do. So all that to say, I mean, it's fairly vast in terms of the different routes that you can go with optometry. But again, that's just where I went.
Okay. And so primary care, just to reiterate and clarify, is
Mhm.
is what I personally would be used to if I wear glasses. Is
Yeah,
somebody I'd go, okay.
yeah,
Gotcha.
yeah, yeah.
Gotcha. Okay. Man, I mean, I appreciate you kind of exposing listeners and myself to the different types that are out there because,
hmm
again, like, no idea, no clue. Just,
Yeah, and honestly, I had no idea until I went into optometry. I didn't realize how vast it was.
I mean,
I
it is
thought,
fascinating. I'm
yeah,
like completely
it is.
fascinated right now.
Yeah, it is very fascinating. Yeah.
Man, that's awesome.
hmm
Okay, so you have to tell me about the third part now.
Yes. So ophthalmology. So ophthalmology goes through the route through medical school,
Mm-hmm.
and so they go through their traditional 4 years of their bachelor's or undergraduate, and then they apply to medical school, and then they specialize in a residency, and then they go into a fellowship, and so it kind of just narrows and narrows and narrows. And so with medical school and ophthalmology, you go, what you think of medical school, you go through 4 years, understand general medicine, how everything works in the body. And then you have maybe one class. I don't really know the schedule of medical school, but I imagine it's a class or a topic about the eyes. But considering, the whole body, I'm sure there's, that's only a small portion
Mm.
of what they go through. And then after that, when you apply for your residency and when you do your OR matching, then you get into ophthalmology, and that's when you specialize in the eyes in that sense.
I see.
hmm
Okay, that makes sense.
hmm
Kind of.
Yeah.
But so what you're saying, so an ophthalmologist would be somebody that like cataract surgery, like things
Yeah,
like that.
exactly.
Okay.
Yeah, yeah. And so just about every ophthalmology practice does some form of surgery. The only
Okay.
exception to that would likely be neuro-ophthalmology, where they don't really do surgical procedures as much. But every other subset of ophthalmology essentially does a surgical route. And so that's where the main difference lies with optometry and ophthalmology. Optometry can do the full scope of, prescribing eye drops, for example, for glaucoma, if their eye hurts or if they need like a steroid or something like that.
Hmm.
They have in most states, they have the exact same rights as an ophthalmologist does from that standpoint. And so where it really sets the difference between optometry and ophthalmology is that ophthalmologists do surgical procedures on the patients, such as,
Mm.
like you said, cataract surgery, or if they need further intervention for glaucoma, for example, if eye drops aren't working, or if there's some complications of diabetes that's going on in the back of the eyes, or if they have like a retinal detachment or something like that, then you would see an ophthalmologist to go through that surgical procedure. And then after that, they go, usually there's a really good coordinated care between optometrists and ophthalmologists where optometrist sees the primary care and then they see something wrong. They refer to an ophthalmologist, do whatever procedures they need to do, and then they refer right back to the optometrist, and then they continue seeing them for their primary eye care.
I see. Okay.
hmm
I see. So, um, what does a typical day for you look like then? Like on the
Yes.
job?
Yeah. So for me, like I said, I had just finished my ocular disease residency about 2 weeks ago. So this is actually my first week Oh,
Congrats.
thank you very much. Thank you, thank you. Yeah, it was a long year, but I definitely learned a lot from it. But yeah, so this is actually my first week as a post-resident eye doc. So right now I am at this corporate location here in Columbus, Ohio, and I work there part-time, essentially Monday through Wednesday, some Saturdays as well. But then on Thursdays and Fridays, I work at my residency place that I went through, which is a co-management of ophthalmology and optometry.
Okay.
And so I get kind of like the full scope of things. I'm getting the primary eye care with with my Monday through Wednesday schedule at iMart, and then I see a lot of medical and more serious conditions regarding the eyes and managing that on my Thursday, Fridays with the ophthalmologists. And so on my Monday through Wednesday schedule at iMart, I'm the only doctor that's there.
Okay.
So I'm seeing them essentially from start to finish.
Which, okay, I have to say again, is so crazy for me that
Yeah.
like, but anyways,
Yeah.
that you're the doctor in the house,
Yeah,
that
yeah. I mean,
that
it's still like
has all the answers. Little
yeah.
Jason Rowe, okay?
I I know. It's still surreal to me. Yeah, like just because I recently graduated last year, but like, yeah, it still feels really surreal that I've made it this far looking
Yeah, it's
back.
amazing. All that to
Thank you.
say, it's truly amazing. I'm
Thank you.
so proud of you,
Ah,
seriously.
thank you. Thank you.
Okay, so you're the only doctor there.
Yeah, so and I mean I surprisingly see a lot of stuff there, but I'll allude to that later. But anyways, that's my Monday through Wednesdays and some Saturdays. And then my Thursdays and Fridays, I work with ophthalmologists along with other optometrists. And their system is a little unique. They basically have optometrists look again at the main primary eye care conditions and things like that. So if they have, cataracts that they need to be watched for, if they have glaucoma that's starting to happen, optometrists such as myself, I'll treat and manage. But the final say and final decisions usually from the ophthalmologist because it's usually their patients at the end. And if they need any surgical interventions, that's when they'll typically come in. But for the most part, they trust us regarding the ophthalmologist. They trust in what we do, and they usually don't really change anything that we say just because they understand that we're fully capable doctors as well.
Sure,
And
yeah.
so whatever they do, whatever we say and what we do, they'll usually just go with it. And of course, if we have questions, because they deal with more pathology and more, if something's really messed up, that's where they step in case they need a surgery. Okay. So they're more comfortable in that spot as opposed to optometrists. We understand what conditions are, but in terms of, the surgical management and the nitty gritty details and what it is and what to do, that's where, we know when we should refer. But in this case, it's a co-management, which is nice because then they're in there in case there is something emergent that needs to be done. They're there. So that's a day in the life in my optometry co-management practice. And so during my time of residency, I was usually the main preoperative and postoperative optometrist for cataracts. So that was a huge thing.
Wow.
So I would see them.
So what is cataracts?
Yeah. So in the basic anatomy of the eye, you have a lens, and that sits right behind the colored part of your eye.
Okay.
And the main role of the lens is basically to bend light rays to have it meet at the very back of the eye.
Okay.
Called the macula. Mm-hmm. The macula is basically just a subset of the retina, essentially. Okay. It's part of the retina. So you can just say retina. Yeah. And so the lens kind of it's flexible, and so it can contract, it can retract, and things like that. And so its goal is to bend light a certain way to let you see. Its other main job is this other thing called accommodation, which is basically a focusing system that you have that allows you to see up close. And so if you are you wearing your contacts, for example, right now?
Yes, I am.
Okay. So for example, if you're wearing contacts, you're no longer nearsighted. I'm assuming you're nearsighted.
I cannot see far. Yes.
Yeah. So you're nearsighted. So with the contacts, if you kind of put your hand out in front of you, you can purposefully make it blurry with your
Yes.
contacts on.
Yes.
But if you have your contacts out with no problem, it'll be nice and clear because you're
Yes.
naturally nearsighted.
Yes.
And so when you're wearing your contacts and you stare at your hand, you make it blurry on purpose, but you can focus in on it and make it clear.
Yes.
That process from blurry to clear is called accommodation.
Okay.
And you are using the lens in the back of your eyes to allow that to happen, to allow yourself to clear things up close.
Okay.
And as you get older, the lens loses its flexibility. And so it's no longer able to, quote unquote, accommodate. And so that's why, you start seeing people that depend on reading glasses or, in their early 40s, I used to never have to wear glasses, but now all of a sudden I have to buy these over-the-counter reading glasses to help me see. And that's because of the lens, they've lost their accommodation. That's a quick tangent of what the lens is, but coming back home to cataracts. So I'm sorry.
No, don't be sorry.
Yeah.
I asked the question.
Yeah. And so with cataracts, what that is basically just a densening and hardening of the lens. Initially, when you're born and in your younger years, the lens should be nice and clear. That allows light to come in directly through the lens. But over time, the lens opacifies, and that's through, just general UV light absorption from the sun and things like that. It's just a natural aging progression. Just like your knees ache as you get older, you develop cataracts. It's not a disease. It's just what happens in life as you get older. So 100% of the population have cataracts if you live long enough. So earliest signs are typically about early 40s-ish, late 30s, early 40s. But if I were to see a 50-year-old patient, I would put money that patient has cataracts no matter what.
So what is this fix that is happening as you do surgery?
Yeah. And so with cataract surgery, what they do is they actually come in from the side. And so your lens sits in this bag, essentially. It's called the capsule. And so when they do surgery, they use an ultrasound to break up the lens into a tiny bunch of little pieces. And then they use a vacuum to suck it all up.
Oh my gosh.
Inside the bag. It sounds really terrifying.
That sounds horrible.
Yeah. At first it sounded terrifying, but the process itself is actually only 10 minutes. The whole cataract surgery is only 10 minutes. It's a very quick, very low risk procedure just because it's so commonly done and it's so necessary, especially with this aging boomer population.
Yes.
More and more cataract surgeries are being done.
Interesting.
And so basically you break it up and then use a vacuum to suck it up. And then you put in an artificial lens with, through this injection pen essentially. And so you put it right back in the bag or the capsule, and then you allow it to unfold, and then it just sits right in place.
Huh.
Yeah. The anatomy of the eye is really cool.
Crazy. Oh my goodness. Okay. What were we talking about something before I asked this question?
About cataracts?
Well, you were telling me you're responsible for the pre-op and post-op of the cataract surgery.
Yeah. Yes. So I'll usually, recommend, there's different kinds of lens implants that you can do for cataract surgery.
Okay.
And so, if the insurance, your health insurance only covers, what you call a standard lens. And that basically, or let me backtrack real quick. So with cataract surgery, the unique and nice thing about it is that when they do the lens implant, they can actually customize, not exactly, but just about your glasses prescription into that lens. So you reduce the dependence of glasses after cataract surgery. So if you're nearsighted, for example, they can put whatever prescription you are, if you're like a -4 or something, they can put a -4 prescription essentially into that lens. And therefore you would not need glasses for a certain distance. And that goes into more complicated things in terms of the different types of lenses. But there are different premium lenses that gives you better clarity, what they call extended range of vision, where, you can see far away all the way up to up close and things like that. So there's a lot of
That's
different,
crazy.
lens options that you can do. Yeah.
And so you have to tell them about it.
Yeah, I have to let them know that such things exist because a
Okay.
lot of people don't understand what cataracts are.
Sure,
Really,
sure.
what they just follow what their primary eye care doctors tell them, and that's the unique thing about my practice. We are a referral center, and so we get referrals from optometrists from all over the state.
Hmm.
Basically, hey, this person has developed cataracts. Glasses just aren't cutting it for them anymore. They need surgery, and so they'll come to us, and then we'll look at them. We'll get measurements to see what kind of lens implant is good for them. And then, of course, we do the surgery. And then either myself or someone else will look at them post operatively. And then after that's done, then we refer them and send them right back to their primary optometrist. And then from there, they just constantly watch them as scheduled.
I see. Okay,
Mhm.
cool. So could you tell me a little bit more about like your Monday through Wednesday schedule? And
Yeah, yeah. And so that practice is, like I said, it's called iMart. That is more, it's a corporate chain,
mm-hmm.
but it's a unique corporate chain in that within each corporate chain and each practice, the optometrist that is there has his or her own reign in terms of how the practice flows.
Okay.
Yeah, so it's different from like if you were to go inside, and again, even this has some variants as well, but just to be generic, like if you were to go inside like a Walmart, for example, you have to meet Walmart's quota, for example, of seeing X numbers of patients. And
I
so
see.
you wouldn't have, because of the quota that is needed for, like a Walmart or Target Optical, something like that, you would not be able to have the flexibility to do the full scale of eye care that an optometrist would normally be able to do, such as,
Okay.
dilating their eyes, looking at the back, looking at the health. They're primarily more focused of, just what glasses prescription can we get for you? And of
I
course, that's
see.
not what they mainly do. But there is a need for that practice and modality of optometry as well. So it is important to have, but that kind of is an oversimplification of what optometrists can do. And so mine is, I guess, classified as a corporate chain, but it's unique in that it almost works like a private practice, to where I can, see patients at my own pace, and I can make sure I get a good look at them, through their whole eye health, not just
Mm,
glasses and contacts. And so
mm.
I have several patients that I'm watching for complications of diabetes, for example. It's called diabetic retinopathy. Retinopathy is pathology. And so diabetic retinopathy, glaucoma that I'm watching with eye pressures, watching people for cataracts as well, see if, when it's time for them to be referred out to an ophthalmologist to do the surgery before I see them again,
Mm-hmm.
and things like that. And so that's more of a day-to-day basis for me at iMart. And of course, I've seen tons of things that I've referred. And so my practice specifically is a little unique, because where I'm working at has a pretty strong minority demographic. And so I'm
Really?
seeing a lot of, yeah, so I'm seeing a lot of patients that have the perception of, as long as I can see, I don't need to see you. But then all of a sudden, they come in with, like I was talking about earlier, they just come in, oh, my vision is blurry all of a sudden. And then all of a sudden, I see all these crazy things going on in the back of the eye. And I'm
Wow.
referring people to neurologists, endocrinologists, or primary care doctors. If I see diabetes, um, things like that. This was about 5 weeks ago. I actually had to call the ER after I found something in the back of the eye because they had essentially a stroke in the eye, because I saw a blood clot in the vasculature of the retina. And
Oh my
so
gosh.
that, it's called a central retinal artery occlusion. And so if that dislodges even further, it can actually go to the brain, leading to an actual stroke. By definition, it still is a stroke. It's just an eye stroke. But if it's not taken care of, it can happen to the brain. So
Jason, you saved someone's life?
I wouldn't go that far, but
That's crazy.
yeah. So I don't, I mean, unfortunately, I hadn't followed up with him. So I think my other partner followed up with him. So I'm not entirely sure what happened with him, but it's instances like those which make it really rewarding.
Yes.
Yeah. And so there are like a lot of things like that that happen, saving someone from, potential, and this is less severe, but like worsening complications of diabetes. Like I had talked about, I had discovered multiple sclerosis in a patient before. People with headaches, I've discovered what they call pseudotumor cerebri, where basically you have an increased, brain pressure, and there's so much brain pressure that it actually all the pressure pushes forward into the eyes, and so that's causing headaches, blurry vision, things like that. And so that requires,
Interesting.
a pretty emergent referral to
Sure.
a neurologist or a neuro-ophthalmologist, for further treatment and intervention for that. And so I mean I've seen some crazy things, and
That I
and yeah.
literally it's just so fascinating to hear you talk about it because well, one, as a patient, right? Like,
Hmm.
say I'm going in for blurry vision and I'm just thinking I'm going to get a prescription, and then there's
Yeah.
this revelation of, it's deeper than that. It's more than
Hmm.
that.
Yeah.
And it's something that you need to address. And it's
Hmm.
not just your like vision, it's like your body, right?
Yeah,
Like,
yeah, and that's a huge part of optometry. Like I said, just because it's such a unique organ in that you can see the blood vessel, and that it tells so much of what's going on in your whole body. If you have high
mm,
blood pressure, you can see, complications of that as well. And going back to my Monday through Wednesday practice at IMART, again with the minority population as well, a lot of them, their first eye exams are at 25, 30, 40, even 50 years old,
mm.
and they don't complain about anything and they think they see fine, but then all of a sudden, I show them this prescription and their whole world is changed drastically just because they thought they were seeing fine, but they didn't realize that their vision could have been improved that much.
Sorry, I
Yeah.
just thought of my friend who like got LASIK,
Oh
but then
yeah.
like for a long time, he just thought everyone saw blurry, right?
Yeah. Yeah. You'd
Because
be
like
surprised how many people think that. Yeah.
yeah, and I'm like,
It's fairly
what?
common.
I was like, what are you saying right now? He's
Hmm.
like, yeah, I just thought people saw blurry, and I'm like, that's crazy to me. But
Yeah.
yeah,
Yeah. Yeah. That happens all the time. And that's what makes, my practice there at IMAR, it makes it super, super rewarding because there's a really big Somali demographic there. So, patients
Somali.
that,
Do you say Somali?
hmm,
Okay, okay, got it. Okay,
yeah,
sorry,
yeah,
just
yeah, yeah. And so, Columbus, Ohio just has a lot of that demographic. And so I see
okay.
a lot of them. And so a lot of them require a lot more patience because they're not really English speaking
I
as
see.
much. And so a lot of them require translators and things like that.
Mm,
But I mean, there are days where it gets pretty frustrating, of course, just because, lost in translation and it gets
sure.
difficult. But, in some of the cases that I've seen, it makes a huge difference for them. It makes it super, super rewarding more than, a traditional practice where, if it's a more well-off society or economic standpoint, they're just in there for glasses and out, and it's
Yeah.
just nothing new. But, there are a lot of big, eye-opening, opportunities that I have there. And I mean, it's almost on a daily basis. There's at least one patient that, had never had glasses and it's just mind blown by how well they can see. Even children as well, because they don't complain because, like your friend, for example, they just thought everyone else saw that way,
Yeah,
and that
yeah.
applies to children as well because they don't know any better. And so when they come in, when they realize they failed their eye screen, at school, for example, they come into us, looking like, hey, my daughter or son failed his or her, um, your screening exam, and so I show them a glasses prescription, and you see eyes lit up, and like they didn't know they could see like that. They didn't know they were supposed to see like that,
Yeah,
and so a
yeah.
lot of that is very rewarding, just because again there's just a loss of understanding of vision and how important it is to get your eyes checked even if you don't feel like anything is wrong. And so there's a lot of rewarding aspects of optometry.
Yeah. Yeah,
Hmm.
that's so great. I'm like that was me, elementary school.
Yeah.
8 years old. I like had no I you know, but I was worried about getting teased, and I
Hmm.
knew because my parents both wore glasses, and I knew like, oh, I probably need glasses. But then when I wore them, I was like, oh,
Hmm.
I don't, am not stressed at school because I'm like struggling to see the board.
Right.
And that's
Right.
awesome, though. It really does sound like you found your purpose and what it is that you're doing, Jason.
Oh
It's
yeah,
really awesome.
I love what I do.
That's awesome.
Yeah.
Um, Okay, so I need to backtrack just a little bit
Hmm.
because I'm curious to the process of getting into optometry school after your bachelor's. Like,
Hmm.
is there a test that needs to be taken to get in, or?
Yeah, so there's like the different schools, like the DAT for dentistry, there's also what they call an OAT, and
Okay.
that's the main test that you do. It's divided into two sections. There's like a reading and I think a math. It's been a while since I took it. I think there's a reading and mathematics section, and then there's a general science section.
Mm-hmm.
And then there's like biology, chemistry, organic chemistry, things like that, like subsets of that. Basically like a DAT or an MCAT, essentially. And so you do have to take that test, and then you use that score essentially in addition to your GPA and bachelor's degree to apply to optometry school, and they use that to go through the interview process. And then
So I heard there aren't a lot of optometry schools in
that is
America.
correct. So I think there's it's hard to say because there's a lot of new schools opening up recently, but I think there's about 30, 33, something like that.
Right, that's not a
Yeah,
lot.
like low 30s. Yeah,
Yeah.
and that's part of the reason why I ended up in Ohio was because there's actually no optometry schools in Georgia.
Yes,
Um,
that's the reason I know that because I know someone actually that actually goes back and forth to like Alabama or something.
oh yeah, yeah.
I don't know.
Hmm.
Actually, I don't know
There's
what state it is, but
yeah, there's a school, University of Alabama at Birmingham. That's an optometry school there.
okay, yeah. And
Um,
so I know that she told me she just comes home for the weekend because there's not that many optometry schools.
That's correct. Yeah. And so the closest one from, the metro Atlanta area is Birmingham, which is, I think it's about like 3 hours, 3.5
Mm-hmm.
hours, maybe,
Mm-hmm.
maybe 2.5. But anyways, yeah. So that's the closest one. And so it can be pretty competitive just because there's not
Sure.
that many schools of it.
Yeah.
And again, optometry is not what it used to be. It used to be, just purely the glasses, but there's been a huge shift into the more general primary eye care, especially because of again the booming population, the
Mm-hmm.
baby boomers and the overall aging populations. There's just so much more pathology and more things that need to be addressed, from a surgical standpoint from ophthalmologists, that they don't have the time, or they just don't have the ability to take care of all these patients. And so they're relying slowly through optometrists because they're realizing, how, competent we are in order to
Mm.
deal with these kind of things. And so there's a big shift. And it's very different. Like the optometrists that are, close to retirement, they don't know as much of the primary eye care, and that they're what we mainly think of with optometrists, or the average person of optometrists. And then the ophthalmologists, they mainly do that kind of stuff. And so the up and coming ophthalmologists, they understand, the co-management role of
Mm.
optometrists.
I
And I
see.
think initially there was a lot of friction between optometrists and ophthalmologists because their ophthalmologists were worried that optometrists would kind of, take their patients. But then, from a financial standpoint, it makes a lot more economical sense, to manage more cataracts and more surgical things, long term, and let optometrists, be able to co-manage and know when to refer, just because they get more referrals. And so
Sure. Yeah.
it's becoming a lot more cooperative, profession between the two. Initially it wasn't like that, but
Oh.
now it is. And so even some states, some optometrists, such as in some states such as Kentucky and Oklahoma, among others, they can actually do some surgical procedures.
Oh, wow.
Yeah, so it is a really fast and growing profession, that's becoming more of a medical side because it's a really strong need for it as well. And so that's where the direction of optometry is heading. So it's far more than just glasses and contacts, that's for
Yeah, I
sure.
mean, I'm definitely learning that today. It's like
Yeah.
really cool. So while you were in school, Jason, like,
Hmm.
was there anything that was like maybe challenging for you, or like in the middle of school, did you ever like doubt or question your decisions at all, or?
Yeah. So all the time, not all the time. There were a lot of hardships to optometry school because it was very challenging.
Mm,
Um, and ironically, like even though I knew that this is what I had wanted to do, um, it like science was not natural for me, and that definitely carried through to optometry school. So like understanding, basic biology. Like I in high school, like I don't even know if I've ever gotten like an A or anything like that in biology or like
mm,
hard sciences like that. It just didn't come natural to me. And so going from that in undergraduate where it's just a few classes here and there about biology, which is my major by the way, with biology and biological classes, then even further going into that, I mean, it did not come natural. But I after talking with my brother, my parents, and the people close to me, I found that perseverance and drive to be able to kind of push through that. And there's a really good support system in general at school as well. It's not as competitive as let's say medical school where you're
mm.
kind of competing with your class to get that residency spot,
Right, right.
because that is a really competitive thing. And so there are moments where people don't like study with each other just because like they don't want them to succeed more than they do or more than the individual does.
Sure,
But
yeah.
yeah, that is not the case at all in optometry school. Like we are all one you know family essentially. And so my school at Ohio State, which is where I went to for optometry school, we had I think 64 students. And so I mean, we were in my class specifically, we were like one big happy family. Like you
Yeah.
could line everyone up, I could name first last name and a unique fact about each person. it,
Yeah,
it was
yeah.
like that. And like we were really tight knit, and so we had a lot of support for each other, which was good. So all that to say, it was definitely challenging, but
Mm.
we all went through it. And so everyone will be able to go through it if they put their mind to it.
Yeah, yeah. No, I mean,
Hmm.
I think it was just really important to um, tell people that maybe are considering it that it's not like just a walk in the park. And
No,
uh,
yeah, yeah. The
no, because
title.
okay, the reason I asked
Mhm.
too is like I don't want there to be a misconception of like um okay, don't take this the wrong way,
I won't.
okay?
Yeah, yeah,
But like yeah, like comparing it to what your parents kind of wanted you to do as a medical doctor,
yeah,
right? And then there's optometry where it's a medical doctor from
yeah.
especially from what I've learned today.
Hmm.
And people thinking, oh, like this is the easier route or the lesser than,
Right.
and it's clear that it's not, you know.
Yeah, I mean, just with any profession, whether it's like physical therapy, pharmacy, dentistry, like being a doctor does not come easy. It takes
Yeah,
a lot of work, and
right, right.
no matter what type of doctor you become, even if it's a PhD, for example, you're
Mm-hmm.
still a doctor. That takes years and years of work after your bachelor's. And so people have to remember that, the salary and whatnot, that doesn't come easy. If it was,
Right.
everyone would be an optometrist, everyone would be a dentist or whatever. But obviously that's not the case. And so you really have to find your niche in that situation, in healthcare specifically, just because it's such a narrow route once you find that route. You know what I mean? And
Mm,
so like with dentistry, for example, it's very easy in terms of the route you take. You go through bachelor's, you go through dentistry, you practice. Same thing with physical therapy. You go through bachelor's or your undergraduate physical therapy school, practice, medical
mm.
school, all the same thing with healthcare professions. And so it's a pretty straightforward route. It's just, you just have to know that that route is the route for you. Um,
Yeah.
as opposed to like business, for example, where you major and then it's like, now what? And that
Right,
wasn't
right,
for me. i
right.
i needed that direction, and
Yeah,
that's
yeah.
why. Yeah, and I've always had a knack for wanting to take care of people and kind of forming those relationships. And I
Mm,
felt like especially after shadowing that optometrist, I felt like that was just the perfect job for me specifically, just because, I personally saw myself not willing to go through that much schooling again, having that life or death kind of decision weight upon me. I didn't want to go through that. And so, I found the perfect, compromise between it, throughout optometry. And one of the practices that I went through for my externship, for example, they've been around since 1943.
Wow.
Yeah. And it was 3 generations of optometrists.
Amazing.
Yeah.
I love like legacy stuff like
yeah,
that.
yeah. I love it too. Yeah. I have a classmate of mine. I mean, I think up to like great grandfather, he was an optometrist as well. Yeah. So it's like 4 generations. So it's like really cool to see that kind of, path exists. So yeah, so that's what I really love about it, is that, it's a family type thing. And I love, you know, forming those relationships with my patients, which is really rewarding for
Yeah,
me. And
that's
so,
amazing.
mhm.
Okay, so Jason, I've never done this before, but I
Yeah.
fielded questions in social media because I knew I was going to have this conversation with
Oh,
you.
yeah.
And I was like, is there any questions that you'd want to ask an optometrist? And so
Oh,
I'm going to look
interesting.
at these
Yeah.
questions real fast.
Okay. Yeah.
Not a lot, well, more than I expected came in,
Yeah.
actually. But
Okay.
okay, give me 1 second.
Yeah, no worries.
Okay. The first question
Mm-hmm.
is, do I really need to throw away my contact lenses after 2 weeks? And I read this, I was like, this is a great question.
Okay, so I mean, I get it. Like, you want to save money, but
Uh-huh.
let me tell you, especially at my residency through ocular disease, I've seen this condition called a fungal keratitis, which is basically a fungal induced complication. And this is just by overwearing contact lenses. She overwears them. She, what you call, top off her contact lens solution, by not replacing the solution every night. And it's all these little things. If I just do that, then it'll be okay. If I just sleep in my contacts for this one night, it'll be okay. If I overwear it by 1 day, 2 days, 1 week, it'll be okay. But all these things accumulate, and there's a much higher likelihood of you getting a complication. And so this specific patient that I had in mind, I mean, she went from, and she was only, I think, early 30s as well. So she was a very young patient. And so she essentially, just what we call light perception and hand motion, where she can only perceive motions of the hand. Of course, that is a really rare case, but you don't want to be that one person.
Okay, so like, if I'm real, right? Like, yeah,
Mm-hmm.
I try to drag out my contacts as long as I can because of
Mm-hmm.
money, right?
Mm-hmm.
Because it's so I feel like it's so wasteful sometimes.
I like I said, I totally get it. Like, I would want to save money in the best way as possible, but I mean, if you look at it in the perspective of, you only get one set of
Yes, so
eyes.
I was just gonna say
Yeah.
that, right? So
Yeah.
like I remember my mom like found out I was doing this, like even when I
Mm-hmm.
was younger, and she was
Mm-hmm.
like, Blair, like you literally only get one pair of eyes.
Yeah.
Like it's not a big deal. And I was like, okay.
Yeah.
But
Yeah.
yeah,
No,
I mean,
it it's hard to perceive, going blind. And like, again, that was like a unicorn case. It's super rare for that to happen, but all that to say, it can
it
happen,
does happen.
Yeah. And
Yeah.
so my biggest advice is, I mean, obviously I can't force anyone to do that. If you can help it, wear it as it's scheduled. If
Okay.
it's a 2 week replacement, wear for 2 weeks. Of course, don't sleep in them, don't swim in them, especially in like a lake. That'd be the worst thing to do.
Oh god. Ugh.
Yeah. I mean, you'd be surprised, but yeah, like, follow it as best you can. But the moment you notice something off, come in and see the optometrist, and get it checked, because some bacteria that get on your eyes from those complications, it can go downhill real fast if you don't catch it early. And
Okay.
so you want to catch things before it gets too late. So if it's not tolerable anymore, don't just wait and think it'll go away in a couple of days, see someone just in case. Again, the likelihood is really low. I feel like it's my duty to say,
Yes.
wear it as you should every 2 weeks,
Yes, Dr.
but
Jason.
yeah, but of
Got
course
it.
I get it. But yeah, that would be that would be my response to that question.
Okay. It's a great answer.
Thank you.
Don't overuse your contact lenses. You're going to go
Yes.
blind.
Yes.
Okay, next question. I've actually never asked any of my guests this question because for a lot of reasons, but
Okay.
I'm not asking it, someone else is. So,
Okay.
what's the earning potential of an optometrist?
It varies quite a bit. So I'll start with the ceiling first. At least the ceiling that I know. My economics optometry professor, he said he was in the top 0.3% of optometrists. And
0.3.
yeah, 0.3, not even 3% or 30%,
Okay.
0.3%. And he, I mean, well into six figures. I mean, like he's making like at least 500K, I would imagine.
Wow.
Like he gets paid like tens of thousands of dollars to travel and talk about business of optometry. And so he's this head honcho business guy.
Okay.
And so he's way up there.
Okay.
So I mean, that's always, the ceiling of optometry and potential for that. And of course, I'm sure there's people that make more, but that's just me personally that I know. Average salary nowadays, I think you can expect at least six figures. That's for certain. I think you're cutting yourself short as an optometrist if you accept anything less. Of course, there are different factors that play into it. If you work, for the VA, for example, it might be less than 100K, but you
Sure.
get the full health benefits, which is huge.
Right.
Things like that. PTO, you don't have to work weekends, no on-call hours, and other benefits you have to consider. So of course, each story is unique in that sense. But I would say, as a general rule of thumb, this is going to be a pretty big range, but I would say anywhere from about 100 to about 250 would be the general range. Yeah.
Nice.
Yeah.
Nice.
So I mean, you definitely get paid. That's for certain.
Everyone go be an optometrist. That's awesome. That's great.
Yeah.
Okay.
Yeah.
Okay, good. Okay, next question. Okay, I feel like you touched on it already, but this person wants to know, what brings you the most joy about this job?
Oh, yeah. So basically back to what, I talked about. And I don't know much about this podcast specifically, so I don't know if there's any religious affiliations of this, but I view myself as a Christian, and so one of the biggest drives for me is that I've always wanted people to see the world as God intended it to be. And so, for vision specifically, even if it's a small prescription, like for example, I have a really small prescription. I don't really need to wear glasses, but I like to wear it because it just sharpens things up that much. And so, even if it's like, I use the analogy of, would you rather watch, a 1080p or 4K television?
Yes, it's a good analogy.
Yeah, it's just right to where it's not like you can't enjoy a 1080p, but you just appreciate the sharpness and clarity of it, of 4K, or nowadays an 8K television. It's just that one step higher. And it's just, especially when you go look, if you're hiking or whatnot, and kind of see like the natural landscapes of the earth. Like for example, I went to Denver because I sweat a lot. I didn't wear my glasses up the hike, but I brought my glasses to put on when I wanted to look out, and it was so gorgeous. I just this epiphany moment and things like that. And so that is more of like my joy, is like, I want people to see the way that, and see the beauties of everything that, the earth has to offer in that aspect. And so that gives me the joy. And then there's the other joys that I alluded to before, like people who don't realize, how, first of all, how important your eyes are. If there's nothing wrong, there's no reason to see you. But then as I'm learning, especially with this minority demographic, there's this population, they think they're seeing fine, but in reality they're not. And so most most cases, a simple glasses fixes the problem. A simple glasses prescription, and they're, like I said, mind blown, especially with the kids as well. They don't realize what they could see. And so that expression that I see initially, this, you see the smile behind the phoropters, you just see their teeth, and it's just like lighting up, and that brings me so much joy.
Yeah.
There is, yeah, especially like I said, with a minority demographic, and I say that a lot, but also there are other, Caucasians that also feel this way. But for me personally, as a minority myself, it
Yes.
resonates just a little bit more with me, with the minority population. But they just have such a sense of thankfulness and gratitude,
Yeah.
with the things that I do. And of course there are exceptions to that, with as there are to anything. But in general, like, they just are so pleased with what they're able to see and what they were able to get as a result of, having their eye exams done. And I get that same thing at my ophthalmology co-management too. Like, if I look at patients pre and post operative cataracts, like, their world is flipped. Like,
Sure. Yeah.
because cataracts happen so gradually, they don't realize, what has progressed in terms of what they see. And so, yeah, after they get cataract surgery, it's like it dialed back the clock to them like 30, 40 years. And it's just like, whoa. So
Amazing. Yeah.
yeah.
I mean, I love that first part that you said about just, yeah, your desire to help people see the world as God has intended it to look like. And
Mm-hmm.
that makes me want to cry. But yeah, I mean,
Yeah.
that's exactly what you're doing, Jason. I think it's
Thank you.
so cool. So cool.
Thank you.
Okay. Okay. One more question.
Okay.
Um, I think this is a high school that asked this, but
That's okay.
they asked, is my mom right in saying my eyes are gonna get worse if I sit too close to the computer or TV?
That that is actually a very, very controversial question.
Oh,
And
is it?
even in the optometry world, it is actually a very, very controversial question. So growing up, or not say growing up, when I went through optometry school, um, Ohio State as a whole, they actually do not believe that. They actually do not believe that. They say near work causes the progression of nearsightedness. The scientific term is called myopia. That's just,
Okay.
it's synonymous with nearsightedness. So they say near work does not cause myopia or nearsightedness. And so they're looking at other things that may cause it. And so one of the things that they're finding right now, and there's no answer to it right now, but they do think it is some sort of hormonal level that's causing, a nearsighted shift. Because if you look at the world right now, the world is actually becoming a lot more nearsighted, and they're trying to figure out why. And so
So
they
it's
just,
not like phones? That's not the reason?
again, controversial. Like, I personally, this is just my personal
Okay.
opinion.
Okay.
Um, and if any of my colleagues, I don't know how they feel, but I personally believe that it does make it worse,
Mm.
especially at such a young age, just because with the shift of nearsightedness. So right now, like probably about 15, 20 years ago, about 30% of the population was nearsighted. If you look at it in the next 10, 15 years, it's going to be closer to 50%. And so it's a huge shift. And in my opinion, it's hard for me to swallow that with the rise of the digital age, that the rise of nearsightedness doesn't come with it, and
Right.
that's not a causation
Okay.
of it.
Okay.
Ohio State believe that it's correlative but not causative. So there's a
Ah,
correlation of it, but it's not the reason why. They
interesting.
believe it has something to do with outdoors. There's something about the sun's rays that the eyes are not receiving signal wise. Again, they think it's some sort of hormonal aspect of it that's causing the eyes to continually grow, essentially. Basically, the more your eyes grow, the more nearsighted you become. And so they're trying to figure out what is causing the signal to make the eye grow. And so that's the $1 million question that really the whole world is in the world of eyes are trying to figure out, is what's causing these signals for the eyes to grow, and how do we stop it? And so there are, certain things that we can do even right now to this day that we can use to slow down the progression of nearsightedness. We might not know the exact science behind it, but looking at really specific studies and case reports of these methods of slowing down nearsightedness, it does indeed actually work. One of these things are called, there's something called orthokeratology, for example.
Okay.
That's essentially just retainers for your eyes. And so you think like teeth retainers, you just put them in and then throughout the day you take them out. It's the same thing with your eyes. What you do is you put in these eye retainers essentially. And so you put them in, and then when you wake up, you kind of take them out. And so it slows down the progression because of the way that light is being projected into your eyes and things like that. There are
So it's like almost like a lens then?
essentially, yeah, it's like a retainer lens where you put them in at night, but then you take them out and throughout your day, it kind of clears up. And that is something that can be done for what we call myopia control or nearsighted control, to stop the progression or slow the progression of it. There's that. There's what we call bifocal contact lenses that we put in children, where the bifocals where you think of, have the lines at the bottom half of the glasses to help you read.
Yes.
There's that in contact lenses that are put into children to help slow the progression. And I won't get into the nitty gritty sciences of it, but that's an option. And then there's another eye drop that you can put in called atropine, which is it's a very diluted dilating drop essentially, and that also helps slow down the progression of it. And it's a really, really up and coming, type of treatment and management that not many people know about, just because, it's so new, but it is definitely really prevalent. Like, it's to the point where if, I had future kids, for example, I would, if they were on that trajectory of being really nearsighted, I would probably start them on some sort of myopia control treatment, such as my personal choice would be atropine, but such as eye drops. But there are other methods of doing it. And again, right now, Ohio State is figuring out, and among other schools and programs and research programs, they're trying to figure out the why behind it. But it definitely is proven that it does work indeed. That is a given fact.
Interesting. Wow. Because I'm like, all this time I thought for sure it makes things worse. I have my own kids too now, and I'm like, Eli, don't sit so close to the TV. Like, but then, I have really bad eyesight. David has 20/20, my husband. And, but I'm starting to realize like, oh, like maybe this might be a conversation for another day, but like it is a lot to do. Does it have a lot to do with heredity too, like genes?
Absolutely. Yeah. Okay. That's probably the number one risk factor for it. So, I guess your child has a 50-50 shot with yourself and David. But it is important to get, how old is your kid again?
He's 4.
4. Okay. So he should probably have an eye exam again, because he doesn't really know. My recommendation, for him would to be, get his eyes checked, get a baseline. You typically do it as early as 10 to 12 months.
Really?
Is when, you can, but I would say 2 years is when you should get a baseline.
I see.
Just because you never know. There are always things that you can do. And again, he's only 4. He's not going to complain about anything. But it's always good to at least get a baseline check.
Okay.
That'll be my recommendation. Yes, but
I will.
Yeah, and so the peak age of how your eye grows and becoming nearsighted is about 7 to 12 years old, and so just as your body grows, so do your eyes. And like I had mentioned, as your eye grows, you become a little bit more nearsighted. So you actually want to be on average a little bit farsighted as a child. That's actually expected, and you want that so that as your eye grows, you have that cushion to become a little bit more nearsighted, or not as nearsighted, I should say.
Interesting. Okay.
Yeah.
That makes sense.
Yeah.
Makes sense.
Sorry, I know that last question seemed so simple, but it was a very tricky
No, it was
topic.
A very like, but man, I had no idea like things were like that were so controversial in that world.
Yeah, yeah, absolutely.
I mean, it seems like something I'm gonna have to ask you about at a later date because I want to learn more.
Yeah. The other thing, sorry, the last thing that I would say is just because like through Ohio State, like at the very least, get a lot of sun time like for kids. Because through the research, they know that something about the sun is slowing it down because they think it's a lack of sunlight that's causing the progression of
so that kind of makes sense to me though, because like you know, with the increase of screens and stuff, more reasons to like we can stay indoors. More and things like that. That makes sense.
And that's the route that Ohio State is thinking, that it's more of the sunlight, not the screen time.
Interesting.
Yeah. And so
it's correlated,
kind of
but not cause. I see.
Yep. Yeah. So just to hash it all out, just go outside a lot more, I guess. That makes sense. Yeah. And reduce screen time too, I guess.
Oh, okay. Good to know.
Yeah.
Hey, man. Well, I don't want to take up too much of your time because I feel like for me, this has been a really fascinating conversation.
Oh,
and
thank
I
you.
could probably talk about it more. But before we end our time together, Jason, I usually ask people for some advice. You know, do you have any advice for somebody that's maybe thinking about going into optometry or this kind of practice, or any life advice at all?
Yeah, life advice, go with your guts. It tells you a lot. Like I said, I don't have a strong inclination towards science, but I knew that this is something that I wanted to do. And so, I can tell you from personal experience, like back from 8-9 years ago when I was a senior in high school, it's a tough journey. Again, like I said, being a doctor of any kind, and especially as an Asian American, a second generation Asian American, where your expectations are kind of like that. And if that's not your calling, be confident in it. Of course, there's going to be a lot of friction that can kind of happen between you and your parents initially, but in the end, they are your parents and they will absolutely support you in what you do. And I can say that 100% with confidence. I had one of my best friends, for example, of course, as a traditional Asian American, they may have wanted him to be a doctor, but now he's doing full-time comedy and he's living the life in California. He's just, it's so incredible, like to see that aspect. And that's a quick side note. It's just like so much respect for that, to be able to, go not against your parents, but really choose your own path and know that that's what you want to do and persevere. Developing that perseverance is huge because you're going to get a lot of pushback. But once you do, I don't think he regrets it. I certainly don't regret my decision. And I don't think, whoever's listening, you will either.
Well, thank you for that advice. I think, it's important for people to be challenged, I think, in a time where it's so easy to be influenced by the people you're surrounded by, especially your parents. So really sound advice, Dr. Jason Rowe.
Thank you very much. Thank you for having me. I enjoyed it a lot.
I really appreciate you. Jason, would you be cool with if anyone had any maybe questions more about optometry or your line of work, would you be okay with them contacting you?
Oh, yeah, absolutely. Yeah. Shoot me text, email, whatever is easy, Instagram.
Awesome.
Whatever.
Well, you guys, I will do my best to get you connected if you have any questions. I hope you enjoyed today's episode. Please feel free to reach out. You can DM me through social media or you can email me at podcastwigu@gmail.com. Thanks again, Dr. Jason. Until next time, guys. Bye.